Welcome to the First Nations Health Managers Association's weekly town hall, your resource for the latest COVID-19 related news and information. A town hall for us, by us. Over the next hour, you'll hear from health professionals and community leaders covering a range of health topics that impact Indigenous peoples across Turtle Island. Send us your questions to fnhma@ihtoday.ca. We want to hear from you. And now your host, Marion Crowe.
Tansei from the Mississaugas of the Credit, the Haudenosaunee, the Wendat, the Huron. We are broadcasting live from the Nation Talk studio in Toronto, and it is a pleasure to be with you again. I am your host, Marion Crowe. I have the humble privilege of serving as the Chief Executive Officer of the First Nations Health Managers Association. I hail from Treaty 4 territory, Pie Pot First Nation. Hello, Saskatchewan folks. I miss you. I'll be home soon, hopefully, pending COVID. And we have a great show once again lined up for you. If you have a question for any of our guests, you can send that question to fnhma@ihtoday.ca. And those questions, we love getting them. Being interactive is what this show is all about. I know you're watching on ihtoday.ca and maybe you want to rebroadcast this for us. Just go check out that website and maybe you can be a rebroadcaster of the FNHMA town halls as well. So I am going to say it is an FNHMA town hall takeover. Thunderbird Partnership Foundation has stepped up. Dr. Carol Hopkins is going to be co-hosting with us. It's such a delight. A town hall favorite is Dr. Carol Hopkins, and we'll get to her very shortly. But today we're unpacking addictions, restorative justice. We want you to have the tools you need to keep you and your nation safe during this uncertain time. But first, let's bring in our valued partners, Indigenous Services Canada, who are going to walk us through the COVID-19 epi-stats. And joining us from First Nations and Inuit Health Branch in Winnipeg is Mark Sagan. Mark, come on into the crow's nest. Welcome back to the FNHMA Town Hall.
Thank you, Marion, and good day, everyone. I wish to acknowledge that I'm joining from Winnipeg, Manitoba in Treaty 1 territory, home of the Manitoba Métis Nation, and also where many Innu call home. Thank you for having me here today, and it's my pleasure to be invited once again to Nation Talk. Since October of 2020, I've had the privilege of working in a liaison role between Indigenous Services Canada and the Public Health Agency of Canada. Over the past 18 months, I've been able to witness from coast to coast to coast the incredible work being done by First Nations, Inuit, and Métis healthcare providers and community leaders in responding to COVID-19 and in their incredible vaccination efforts with the assistance of provincial, territorial, and federal partners. As of February 1st, 2022, Indigenous Services Canada is aware of 687 First Nation and Inuit communities with vaccinations underway. As of this date, over 1 million doses have been administered of COVID-19 vaccine. And of those, 413,577 have been second doses. Another 117,000 were third doses. This works out to over 86% of individuals aged 12 and over having received a second dose, 2 doses of vaccine, and 23% have even come forward to receive their third dose or booster dose of vaccine. And so far to date, over 44% of children aged 5 to 11 have received at least 1 dose. So a lot of really great efforts are underway to help protect your communities against COVID-19. I also want to really recognize the First Nation, Inuit, and Métis organizations in cities and rural towns who've also played a significant role in creating culturally safe accessible vaccination opportunities through local clinics, transportation assistance, helping local public health authorities to create more welcoming environments, and even carrying out home-based vaccination services. Previous guests from ISP on Nation Talk have shared detailed information about the COVID-19 work ongoing in Indigenous communities. For the latest information on COVID-19 and Indigenous response, I suggest you check out the dedicated ISP COVID-19 webpage. The easiest way to find this page is to do a browser search using Indigenous Services Canada and COVID-19. From there, you can navigate to all sorts of updates, links to websites and materials created by First Nations, Inuit, and Métis organizations, and links to other Government of Canada websites. So I invite you to check it out. I'd like to use my time today to talk about the state of vaccination rollout in Canada in general, where we're at with vaccine availability, and upcoming developments. As we're all aware, the Omicron variant is widespread in Canada, but Omicron continues to be studied intensely in Canada and throughout the world, including how well the current vaccines work against this variant. The body of scientific knowledge continues to grow week by week. Here's what we know, some of which you may have heard already. Omicron has been found to be more contagious than previous variants. And although Omicron has been described as milder for some of the individuals who get sick from it, many individuals who get Omicron can still be at risk for severe outcomes, such as hospitalization, ICU care, or death, as well as having long-term COVID impacts. It's not just a cold for many of those who have gotten it. The most current scientific information is that 2 doses of mRNA vaccines, Moderna and Pfizer, are not quite as effective at stopping Omicron transmission as they were against the Delta and other COVID-19 variants. But there is good news. There is now strong evidence from multiple studies that a complete series of an mRNA vaccine, 2 doses, plus a booster dose, does reduce the risk of severe illness, hospitalization, ICU admission, and death compared to those with only 1 or 2 doses of vaccine. The protection is even greater in comparison to unvaccinated individuals. Think of it like this. Your risk from COVID-19 is like driving in winter. Before Omicron, the roads were bad, but manageable. But Omicron, it's like freezing rain, and the roads are a lot more slippery now. If you're out driving, the chances are greater you're going to get into an accident or that you're going to run into Omicron. 2 doses of the vaccine, well, that's like wearing your seatbelt. If you get into an accident, you might get injured, but you won't get hurt as bad. And a booster dose, well, that's like having airbags also. You're going to get even better protected. Your odds are way better you won't get hurt as badly. But if you're in the same kind of accident, the person not wearing a seatbelt at all, that's like not being vaccinated at all. So that's when you're the most risk for the worst possible outcomes. So just like wearing a seatbelt, vaccines won't make you invincible, but they really do increase your chances of being less harmed if you get exposed. And there's another way to think about all this. Just because your car or truck has seat belts and snow tires, you still need to drive more carefully when weather conditions are bad. So wearing a mask, social distancing, frequent hand washing, all are protective measures that help prevent you getting exposed in the first place. And remember, driving cautiously not only protects you, it protects those in the car with you and those on the road around you. And there's one more point I'd like to remind everyone of. No matter how bad winter is, it always ends. COVID will be behind us one day. But as everyone here in Winnipeg knows, January is not the time for sun tanning. But spring will come like it always does. So in the meantime, stay strong, stay careful, and take the right steps to protect yourself and others. Remember, a complete vaccination series and a booster dose, once you're eligible, as well as protective measures like masking and social distancing, remain the best means of protecting you and others around you from all forms of COVID-19. It's also the best way of preventing local healthcare systems from being overwhelmed. And a bit more information, one of the more common questions we're hearing is, when will vaccines be available for children under 5? Vaccine safety and effectiveness are taken very seriously by manufacturers and government health regulators, especially for young children. Closely monitored trials are underway by both Pfizer and Moderna. And just last week, Pfizer-BioNTech submitted preliminary data to the US Food and Drug Administration for approval of their formulation for ages 6 months to 4 years. This is the first step of the review and approval process, and we will be watching very closely for when they submit to Health Canada as well. In the meantime, the best way to protect those who can't be vaccinated, those who are too young for it, is for those around them to be vaccinated themselves and to take additional safety measures where it's possible to do so. I'm triple vaccinated, and I still wear my mask when I see my 8-month-old granddaughter. And one day I hope I don't scare her too much when she gets to see me without a mask. Another question we've been hearing is, should I wait for new versions of the vaccines before getting my first or second dose or a booster? At this point, there's no way to know for sure when trials will be complete or how long it will take to improve any new formulations. As well, it will take some time for Moderna and Pfizer to ramp up their production. And even then, there's going to be a lot of demand throughout the world for these vaccines once they're available. There's sufficient information now that the 2 doses and a booster of the current mRNA vaccines provide very good protection against serious outcomes. If you're eligible to get a booster within your part of the country, we very much encourage you to get it as soon as possible. In other recent updates, the National Advisory Committee of Immunization is now recommending a complete series of Pfizer-BioNTech vaccine to be offered to children 5 to 11 years. Their current dosing interval recommendation is 8 weeks, as it gives the optimal time for to build up the best immune response from the second dose after 8 weeks. It's also important to consider your own local public health considerations, and we certainly very much encourage you to contact your local physician, your health center, your nursing station, and find out from them what they're recommending for your particular community. If you have questions or concerns, by all means, seek them out from someone you trust from your local healthcare provider, because you as parents ultimately will decide what's best for your children. In other recent announcements, January 28th, 2022, the National Advisory Committee has made recommendations for the use of booster vaccines in regards to adolescents 12 to 17 years of age. At this point, for most adolescents, 12 to 17, 2 doses is considered sufficient for adequate protection. However, those who may have underlying medical conditions or immunocompromised, or those who are belonging to racialized or marginalized communities may want to get a 3rd dose or booster dose, and that is certainly what NACI is recommending for the time being. This would include Indigenous youth in remote and rural communities, as well as urban settings who are recommended for this. Again, just as a reminder, provinces, territories, and your own communities may vary in the eligibility for booster doses based on the local rate of COVID-19 transmission. Some jurisdictions have reduced the eligibility for booster doses, for example, from 6 months down to 5 months due to the high Omicron presence. And this has been applied in some Indigenous communities as well. So again, please work closely with your local public health resources and act accordingly. The other thing I'd like to add is that the guidance from the National Advisory Committee on Immunization is constantly under continual review as new information comes available within Canada and throughout the world. So this is why recommendations sometimes change from what they were just a few months ago, because that's the nature of how science works. As new information becomes available, you adjust your response, you fine-tune it, and you make it what's the best knowledge at the time. And this will continue to happen as COVID progresses. But again, in Canada, when we think of the amazing progress we've all made, including in Indigenous communities, with one of the highest vaccination rates in the world, and how all of us working together have made vaccines available, whether it's from downtown Toronto to the most remote areas of Nunavut or BC or Newfoundland, Labrador. It's just an amazing accomplishment of what you all have accomplished through your caring for each other, working with each other, and helping each other out. As I said previously, it's been an honor and a privilege for myself to be part of this, and I certainly look forward to working with you over the coming months as we continue to get through this. Thank you again for having me today.
Mark, thank you so much for bringing that update to everyone who is tuning in on their radio stations, watching Facebook Live versions, and who will be watching this on Saturdays with our partner APTN at 5 p.m. Saturdays, but double check your local listings just to make sure. Mark, you unpacked so much information into that segment. We really appreciate the partnership and spoken like a true prairie person, making that reference to winter driving conditions. Oh, love it. And thank you for the humor as well. I do also want to say thank you for everybody who's listening and watching. Mary Jane and Tina, good afternoon and hello to you as well. Thank you for watching. We certainly appreciate you getting your credible and factual information here on the FNHMA Town Hall. And again, a reminder, if you have a question for one of our guests, send those to fnhma@ihtoday.ca. And now it is time, like I said, to bring back an FNHMA Town Hall favorite, and that is the amazing executive director at Thunderbird Partnership Foundation, who are taking over the town hall and giving us credible, reliable, factual information. Dr. Carol Hopkins, come on in after we take this break. We'll be right back.
I used to feel such shame. It was hard being surrounded by women who trauma and abuse left cruel streaks, violent behaviors, and disconnected ways of loving. And now I'm freeing myself from that shame. This is where our societies, our circles, our connection to the land comes in. Learn to be kind to yourself and to others.
There's lots of bullying at the school that I come from. I ended up in a neck brace. I had a concussion. I got kneed in the back of the head. Sometimes things can get really bad and you think, oh, like there's no point of like being here. The support from people around you has a lot to do with the anxiety and depression. Because I'm different, a lot of people didn't understand. Through acceptance, we find belonging.
Aren't those powerful words? Acceptance starts with me, and now it starts with Carol. Carol, I almost forgot to throw to the soar above stigma. So come on into the crow's nest, Carol. Welcome back.
Thank you so much, Marian. Wewana bojo, no jem indigenous cause gaye mainga na dodem, lane lanape kwendao lanape aking and donjaba. I'm joining you from the Delaware Nation in southwestern Ontario. It's a good feeling to be back here in the crow's nest, talking to First Nations people across the country. And today, the focus of our show is decolonizing harm reduction. So you might first off be thinking, well, what does that mean? Well, first, harm reduction is a term, is a way of talking about what we can do to help people who use drugs. And most often, harm reduction is described as ways to support the right to live life for people who use drugs and alcohol. And we do that by reducing risks that could cause death or other harms. And so these ways are things like managed alcohol programs, giving a little bit of alcohol to stave off the withdrawals and the sickness that comes with not having alcohol. Safe consumption sites, so people who are using drugs can be monitored, and in case there's an overdose, poisoning, they can be saved with naloxone. Naloxone is about reviving people so that they can breathe again. That precious breath of life given by the Creator can be preserved with naloxone. It's also about making sure people have sterile, clean equipment like needles or pipes. And finally, it's another way of thinking about it is opioid substitution therapy, giving people medicine to manage the chronic illness or the chronic condition of addictions, taking care of those withdrawals so that people can survive. It's a humane way of supporting people's right to life. So all of these can be effective tools for reducing harms associated with substance use. And these ways not only benefit the individuals, but they also, it said, can reduce costs to the healthcare system. And we need the healthcare system to be able to respond to our needs. In case there's COVID, we don't want the emergency room jammed up. We want people to get services when they need them and where they need them. That's harm reduction. It's also about making sure people have the access to the right services in health or social. We're going to talk about that, including treatment. But as First Nations people, what we mean by Indigenous harm reduction or decolonizing harm reduction, it's not just about the person who's using drugs and alcohol. We also are most concerned about family and communities. Those are our core values. So to reduce harms for people who use drugs and alcohol, we have to think more broadly, not just about the drugs, not just about the person who's using drugs, and all of our anger that we might have, frustration, sadness, because we see them in a certain way, causes us to feel sadness. We can't just focus on that. Our teachings say we have to focus on the strengths of people, and that starts with thinking about harm reduction, Indigenous harm reduction, as a way of life. It's grounded in our values, it's grounded in our relationships. It's using what we know from our culture and our cultural practices, our relationship with land, and asking ourselves, what have I done about my relationship with my family, with my community, that makes a place for everyone? So today, we're going to share with you some important tools and resources for wellness. And we have two amazing speakers who are going to share more about what it takes to support Indigenous harm reduction as a way of life. Our first guest, and Ogichida, that warrior for peace, is Jonathan Peltier. Over to you.
Good afternoon, Carol. Thank you, and thank you, Marianne. I just want to firstly say that I'm very honored to be part of this discussion today. Harm reduction is very near and dear to me. Ani Bonjour. My name is Eagle Spirit from the Deer Clan. I walk with the bear. My home is Wikwemikong. My given name is Jonathan Michael Peltier, and I'm in the reintegration worker for the Wikwemikong Justice Program. My focus is to support our band members with the reintegration process after a period of incarceration. Our goal is to lessen our band members' involvement with the criminal justice system with the hopes that they don't return to prison. Our mission is to decrease the overrepresentation of Indigenous people in the Canadian prison population. Now, I can tell you that it's over 30% today, and that is alarming. And I just want to also say that this reintegration job is also near and dear to me. Reintegration and harm reduction, for me, are very interwoven. Having been a former addict and a former prisoner, I can tell you that I know the stigma surrounding being an addict and a prisoner. But for myself, today's topic discussion is harm reduction, specifically decolonizing harm reduction. And before I share my approaches and how I guess I decolonize myself through the process is, I'm just going to give you a little bit of history of my struggles and my accomplishments through this recovery. So anyway, I was really hesitant to partake in harm reduction, especially opiate replacement therapy. I had been an addict for nearly 25 years before I decided to walk through the doors of our community opiate replacement clinic here. And it was then that I was hesitant. Even in the height of my drug addiction, I did hear a lot of bad things about methadone clinics, and I did see And I didn't see any progress from the circles that I was walking in. But I can tell you that a big part of my decision to partake in opiate replacement therapy was my son. My son is 29 now, and when he was 18 years old, he overdosed in Sudbury at a Tim Hortons. And he had to be revived twice on his way to the hospital. And, thank you, Creator, he's still with us. But it was after that incident that I really asked my son, like, well, what can we do to get past this? I was addicted too at the same time. And, I did recommend methadone for him, even though I didn't believe in it. But, my son has a lot of, he really, really wanted to quit. And it was like it scared him. So, we did go take him to the methadone clinic, and he's been doing really well since. And I can tell you that for me to walk through the doors, it was probably thinking back about, exactly what I was saying to him before I asked him, And so anyway, when I walked through the doors of the methadone clinic, I was really, really like, I really wanted to stay out of prison. And for me, going to prison, like all the roads that led to prison had everything to do with my addiction. So I knew from past experiences that if I just kept going on and using that, it would be the same results. I would be in prison. But anyway, it wasn't until I was on a stable dose and I started to add positive activities into my day, and one of them was attending the adult education program here in the community. And it was one day that I was there with the adult ed teacher asked Jonathan, he says, what are you going to do? What are you going to do with your future? And I told him, I really don't know. I don't know. I was a diamond driller in the mining industry for years, but I really don't know. And then he goes, well, you have to find your niche, Jonathan. And I said, niche? What? Excuse me? And he said, well, niche is something that you're good at, something that you're very knowledgeable of, and maybe even skilled at. And, you got to find your niche. And, I really, really pondered that question for quite some time after that day. And I asked myself daily, what's my niche? What's my niche? And then, it wasn't until about a year after I was on the methadone program, I attended a conference where there was guest speakers, keynote speakers, and people talking about their recovery. And I was watching them, and I was just amazed of how much strength they had, and how much how much courage they had to stand in front of a crowd and expose themselves and tell them, tell the crowd of all about their experiences. And a lot of them weren't good experiences, and I could relate with that. I honestly could. But I did admire that strength and their voice and their empowerment. And I wanted some of that. I really honestly did. And, so that's what I did. And one of the quotes I took away from that day, one of the keynote speakers said, you don't need a degree or a diploma to be an advocate, to be a voice for the people that don't have one. And that one really, really impacted me, just that quote alone. So I started being more active in the community, and one of the activities that I was spearheaded was Prisoners Justice Day with the Wakanakang Justice Program. And spearheading that and being a part of that, I was one of 4 speakers. And that really, I start to feel that empowerment. I start to feel that strength and that courage. But not only that, I start to feel the humility, because my stories used to be, glorified. I used to glorify my behavior. I used to glorify my addiction. I used to glorify prison. But one of the things that I stopped doing was glorifying. And I started to talk about the impacts on me, on my family, on my community. And, you know, it was, and I couldn't have done that without my mother, because when I got released from prison in 2011, I was living in Montreal with her, and I was struggling to find a job and struggling to find my footing. And, you know, I felt like I was stagnant and stuck. And I felt like I would never, you know, I didn't have a future because of my, you know, my criminal record and my addictions, and, you know, the stigma was holding me down. You know, it really was. So anyway, my mother told it to me. She says, you know, Jonathan, you have to change the narration of your story. You know, you can't always say that, you know, you've lived a hard life, you've been to prison, nobody's ever going to give you a chance, you know. And she goes, you know, that is true. You have been, and you're going to have a lot of resistance. But, you know, that doesn't mean you can't change. You just have to think about the narrative. And I said, okay. And that's what really, really brought it up to the surface for me. And one of the things that really brought it to the surface too with storytelling is the teaching. My involvement in the community was attending teaching, attending ceremonies. And I'm not a full traditional person. I do, you know, I do smudge, and I wish I did smudge daily, but I do pray daily. And one of the things that, like I said, was one of the things I discovered was that within the 7 sacred teachings was honesty is free, and dishonesty comes at a price. So I really, really thought about that, and I really thought about, okay, I really have to make honesty a truth in my life. And, you know, that's what I did. And when I made honesty a truth in my life, things started to look up, things started to fall into place. And one of the things too that I really, really, really thought was awesome about it is that I started to experience all the rest of the teachings. I found love. I became humble. I have a lot of respect for people and for our community. And I couldn't have done it without our community, because Wiki is a mother to us all here in our community. And I really honestly believe that, and the people that believed in me. And, you know, I couldn't have been in this position without honesty. Honesty was the biggest thing for me. And it was one of those things where you know, it never worked for me to be honest about my past before, my criminal record. It never worked for me. But I can tell you that going back to the teachings, now I know I don't have a lot of time here, but let's just get back to my niche. Now my niche, what I discovered is my experience, my journey, and it has become my wisdom. So, you know, that's one thing that I absolutely have to tell people out there is, you know, let's not let our history be our dysfunction, let it be our strength. And yes, absolutely. And I would just like to say, the next speaker up, he believed in me, he believed in my story, and I owe him a great big thank you. And thank you, Carol, for listening to me today and having me part of this discussion. All my relations.
Wow, what a powerful story, Jonathan. I loved the seeds that were planted through all of your relationships, the things that people said to you, took the time to say, the questions they asked that made you think about the possibilities for your future. What a powerful act of kindness to take the time and say, well, where are you going in the future? Or you can change your story, Jonathan. You have the power to do that. And thank you so much for sharing the power of our own knowledge and our teachings. Hats off to you. I just, you know, raised my hands in celebration as you were talking. And just like you said, we have another powerful leader. And when I say powerful, he too is not afraid to use his voice. his voice for the people because he cares. And so Tim is going to share with us from a community perspective what it takes to support harm reduction. Over to you, Tim. Thank you, Jonathan. Stay for the questions and answers, please.
Wow, Ani Chimigwech. I'd just like to thank everybody for allowing us to be a part of this speaking today. I'll introduce myself as my spirit animal, my spirit name that was given to me. It was Squidnagik, and my clan is the Mangandodem. I'm calling in from Wikwemakansita territory, the home of the Odawa, Potawatomi, and Ojibwe, which comprises of the Three Fires Confederation. So I just want to start off by saying Chimigwech to Nation Talk and First Nation Mental Health Authority for allowing us to speak at this Town Hall Speaker Series. One of the things I want to start speaking on is, again, congratulating and thanking Jonathan for his kind and powerful words. This is what makes our work very rewarding when doing this educational piece, education awareness, all around harm reduction approaches at a community-based level. A little background of how I got into this work. Started years back in 2008, working in our social service department and really recognizing some of the challenges we were having at a First Nation level, addressing opioid dependency addictions in our community. One of the challenges and barriers at that time was a lack of understanding of what harm reduction is in a community setting. We tend to view our recovery beliefs from previous years as abstinence-based treatments. But knowing about the different types of substances of misuse currently, opioids is a very difficult substance to overcome when you're really fully dependent on it. So back in 2013, our chief and council put together a working group to look at how we could address opioid use in our First Nation community. So with the working group, it comprised of our social service department, our police, our health center, our justice program, all of the programs that we've seen our community individuals had some sort of accessibility that they were accessing for some services. So when we put this all together, we looked at how we could do collectively a case management model on how to address opioid dependency when we, instead of the individuals going door to door and getting the runaround for services. Unfortunately, when you're looking at harm reduction and somebody who is going through opioid dependency or other substances of misuse, you start looking at the challenges that some individuals and some of the doors start to close on those individuals because of some of the mistrust what happened for individuals that were going through opioid dependency. They start to go and build disconnections with their families, with their friends and community. So a harm reduction approach and education awareness is kind of directing towards getting the individuals to understand what we are trying to work towards. And you're looking at individuals, everybody needs a second chance when you're trying to go through recovery. You can't close the doors on anybody. You have to ensure that you're allowing these individuals, they want to get the help and they want to get support when they're in these challenging periods of their life. I've seen firsthand to see these individuals overcome their substance misuse addictions. When you just give them that chance, you listen to them, you give them those opportunities to flourish, such as we heard a powerful story from Jonathan previous, just before I am speaking now. And there's a lot of other individuals who require this supports. So one of the things where I was doing was really speaking and using my voice to share this information with our community, because our community at the time in 2013, 2014 weren't really supportive of this type of treatment. It was just because of the colonization and understanding of how this treatment is being offered in other, not only in First Nation communities and urban centers, on how the delivery of services was pretty much facilitated and guided by medical professionals. But when you look at it at a community base, you have to have that interaction and you have to have the leadership, the community, your elders, all a part of this delivery of service. You look at a whole culturally based treatment model when supporting opioid dependency treatment. It's still unfortunate that we are having a very challenging time when working with opioid dependency, because again, it's just the misunderstanding of what's happening and the lack of coordination and communication between all parties that are involved with this type of treatment. So when I was working on doing this and doing a lot of speaking engagements in my community, I did a lot of community engagements at our local, at our arena and at little town halls, doing a lot of speaking engagements, more education awareness to get our community to understand what we are trying to do and support individuals requiring this type of service. It was very challenging. You know, we had times where community members would set up petitions, not supporting this type of initiative. And one of the great things about this was I encourage those people to participate in these discussions, because that's who I want to listen to, hear what we are trying to promote and support individuals that require this type of service delivery. I was actually said, this one individual said to me at one time, there's people who have petitions, they're going to come to this gathering. I said, perfect. That's who I want to be here. That's who I have to get this out to. This is who we need support. And unfortunately, at times you start to recognize you don't really get so much support unless it affects our families personally. In our First Nation communities, we are all very close. We are all family orientated. And, you know, unfortunately, substance misuse disconnects this with our families. But when we come together and rebuild that again, we start to see our communities grow stronger, support one another as we are moving towards the betterment of our First Nation communities. One of the areas I had a challenge with also at the time, because I knew I was looking at a more culturally based delivery service model, was utilizing our elders in our community. We are very rich and fortunate to have a lot of conductors, knowledge keepers, teachers in our First Nation communities. And one of the things I'd like to stress and say is we need those individuals to support all of our areas of moving forward with substance misuse. You know, one challenging point I had when doing this work was not allowing some of the individuals accessing this type of treatment to participate in their ceremonies, to participate in their gatherings, because they had to be abstinent. And one of the things is I spoke to one of the conductors. I said, just allow them to participate. They want to get well. They're working to get well. They are not misusing the substance. They're using an opioid antagonist treatment, methadone maintenance or Suboxone or buprenorphine, to stabilize them. They are not misusing substances. That is just to support them and get them over this, and they need this extra support. So that one conductor opened his arms and he allowed people to participate in a ceremony. And by him doing so, it opened the doors for other conductors in our First Nation community to allow individuals to come and access their services, to attend sweat lodges, to attend ceremonies, to attend teachings. We brought a knowledge keeper directly to the treatment clinic, and he actually seen the people coming in, and actually they were requesting for his help for the counseling component. So I'm not saying Western ways of counseling is a way we should be going, but you have to incorporate both, using Western and our traditional knowledge keepers, both of them working together when working towards the betterment of our First Nation community members. When I seen that change, I really recognized a lot of the individuals in the program really became more grounded, really began to understand their purposes in life, really understanding the culture, the rich heritage of our First Nation communities, because when you're going through substance dependency, you tend to lose that. And having our knowledge keepers a part of this journey and recovery for First Nation communities, it shows that it focuses and betterments our First Nation members who require the supports. One of the next areas I had a challenging time with is working with our leadership. I'm a political representative of our First Nation community. I've been serving as a representative since 2014. And really having the support from our chief and councils to support harm reduction. At the time when we first started this, we had no support. I had no support. I continued going to our chief and council meetings, and they were always telling me, come back next month, come back next month. And I said, I don't have next month. Our community members don't have next month. They could be gone next month. So one of the things as I kept on going, and I brought individuals from the community to support me in doing this, because I was supporting them when I said, I'll speak for you, I'll start, but I need you to help me too. So we both worked together in getting the support in our First Nation community. By doing so, our leadership changed their viewpoints, changed their mindset of how a harm reduction approach, a delivery of service is supposed to be operating in our community, and important of having our leadership on board to support these initiatives. As we know, our leadership do get supporting directives to our program managers, to our frontline workers, and advocating to Indigenous Service Canada, to the federal government, to the provincial government for extra sourced funding dollars. So we need that leadership support when we're doing this type of work initiatives. And one of the great things I could say now is our leadership supports this type of harm reduction approaches in our community. And unfortunately, during this COVID pandemic that's been happening for the past 2 years, we've seen a very increased numbers of individuals misusing substances, succumbing to opioids. And this is a time when our leadership has to be stronger more than ever to support these types of initiatives. I could share that we have discussions currently to really relook at and restructuring the way these programs are being delivered in our First Nation communities. Because again, the COVID had put restrictions on areas where limited interaction between the doctors, individuals accessing services. But, this is where we're all working together to make sure that we are doing this for the right reasons, and leadership, community, and elders and families all coming together in our First Nation communities to support this type of harm reduction approaches at our community level. This is where we see that our land-based programmings flourish, where we have to get back to the land, where we have to utilize our territorial and everything the Creator has gifted us with. In closing, what I'd like to say, and listeners to hear of what I've been speaking about, is, it's not only medical professionals that are coming to our First Nation communities that aren't supporting these type of initiatives. It's sometimes due to limited cultural beliefs in our First Nation communities, but it's also our community members that have become colonized and understanding those ways of belief systems. We have to change that mindset. And when we all come together to understand how we are working towards harm reduction approaches by including a cultural-based delivery service model, this is a way where we could start to really see families building their relationships and getting their children back, getting back to our communities, and supporting that's really required. So with that, I'd just like to say Chimigwech, giving me the opportunity to share some of my insight of some of the work we have done at a community level. And we would really like to encourage people that have any questions to reach out. And I'd like to thank Nations Talk, First Nation Mental Health Association, Marian, and of course, Jonathan and Carol. Thank you so much.
Thank you, Tim, for that great, you said a lot of great things. At the end, you said one more great thing, but you said many great things. So thank you so much for your leadership and for perpetuating our cultural values of, we're an oral tradition. And we talk about that all the time. So we're used to telling stories, but in the telling of stories, that means we also developed excellent listening skills, because we heard the stories and then we have to apply them to our life. And so you opened that up in your community with having those conversations, including perspectives of people who are not sure or were dead set against something and they're going to put up that brick wall. We have to have conversations. We have to share our stories to break through the brick walls, to create change. And that's a key takeaway from your message, is facilitate conversation. So looking forward to you sticking around for the questions and answers. And I want to thank all of our listeners for joining us today. We're going to, Thunderbird and Indigenous Services Canada are going to be answering some of your questions later on. But first, I'd like to share this short video, which is one of those tools for showing you how to manage wellness. It's our new Thunderbird app.
First, it's all about wellness. This section is grounded on the belief that our wellness is tied to one's connection to creation, language, land, and ancestry, all supported by a caring family and environment. There's good information here to help you see how to support your well-being through culture. There's a daily reflection in this section where you can explore ways that support your wellness and connect to cultural ways of knowing. Your answers are only stored on your device, so they are completely private. If you choose to, you can share your reflections and connections on your social media feeds or elsewhere. Everyone gets the same questions each day, so people can share reflections on the same subjects together. Thunderbird Wellness also has an interactive drum, which you can hear when you shake your phone or tap the drum image on your device. As you drum, the app will share concepts about what culture is. The next section is about substances. Here you can find reliable information about opiates, methamphetamines, cannabis, and other substances. You'll learn how these drugs can affect your behavior, impact your well-being. Some can even change how your brain works. The third and final section is surveys, where you get to share your thoughts. Thunderbird Surveys are for First Nations adults and youth. They help improve what we know about the real-life impacts of opiates and methamphetamines. Your answers can inform prevention, treatment, and harm reduction strategies, as well as funding equity challenges and crisis management at the community and national levels. All survey responses are combined to produce a national snapshot of the impact of opiate and methamphetamine use on First Nations people and communities. The Thunderbird Wellness App features light and dark modes. It's in both English and French. It supports text scaling for those who require it. The app is free and can be downloaded today on the App Store and Google Play.
I downloaded the app and I love it. I encourage everyone listening and watching, go get the Thunderbird Partnership Foundation. And it's not just the app, there are so many tools and resources on their website. So just encouraging everyone to do so. I tell you, I want to just give a little tiny bit of feedback to everybody. Jonathan, tears of pride for you for having the courage to share your story. In our stories, we find strength, that's for certain. So let's dive into the inbox, shall we, Carol? I definitely have time to get you a quick question because you gave us so much in all of that content. My goodness, I think half the questions are already answered. But Carol, let's chat for a few minutes while we have the time about the lack of resources. Like, I love Wiki represented today, and thank goodness for those services that saved Jonathan's life. What can you tell us about getting programs to our nations outside of Wiki and others who have centers where we can seek support for our mental wellness addictions? Tell me about that, Carol.
Well, the Honoring Our Strengths Renewal Framework and the First Nations Mental Wellness Continuum Framework are provide good guidance. And so from inside the First Nations community, we heard through Jonathan's story and Tim's sharing how important it is to work across programs and services in the community to collaborate and build that understanding. But when we want to apply many aspects of harm reduction, tools and resources, it requires help And Tim talked about that. We need, more funding at the community level so that the community has the capacity to hire the workforce, to do the outreach, to go out and have those conversations with people who have maybe taken on shame. Jonathan talked about, his mother encouraging him to change the narrative. Well, he was changing the narrative from that place of shame. I don't belong. No one's going to help me. That's every person who is using drugs and alcohol. They're not going to go running down to the health center and say, here I am, I want some help, because they're afraid that they're not going to get that help. And so we need outreach. We need people to be able to go out to the homes and around the community and have those important conversations to connect and help people. But we need funding to hire that workforce, to provide supports to them. And that is funding from the local health authorities, provincial governments, federal governments. It doesn't matter where it comes from, but it has to be at the community level. And we need resources to enable the connection between nurse practitioners, nurses, physicians working in addictions medicine, and our cultural practitioners, our elders and knowledge keepers that Tim talked about, to be able to have conversations with the community government, the chief and council, to help build their understanding about all of the different options available to us. We're in a time, a very, very critical time, that far exceeds what we are experiencing as First Nations with COVID. We're experiencing another public health crisis, and that's all of the deaths that come along with no access to services, not enough funding in our communities so that they could build up a response using their own knowledge and their own culture. We need more resources at the community level. But I also want to tell you a little bit about treatment centers, because they're making a difference too.
Carol, let's save the treatment centers for the next show. I am so sorry that flew by like the wind. And with that, I want to say thank you so much to all of our guests for your bravery, courage, and until next time, stay safe. Hi, hi.